hospice,
Right.
so they were dealing with those. But I think one time when we met about those issues, it was like a social worker, a PA, and a respiratory therapist that
Okay.
were with us, when we were talking about those kinds of issues.
Okay. And then you've kind of hit on the different professions that the social worker interacts with. What did you, and you've kind of talked about this a little bit, but the difference in the social worker's job between the different settings, I think you kind of hit on that mostly. So, the final question was, how did you feel the social worker or different social workers impacted you and the care for your mom?
Yeah, I thought they were pretty good. I mean, they called me several times. I tried to update me. My perception was that they more, like on the palliative care team and
Mm-hmm.
on the hospice team, they were sort of like the spokespersons for the team. In other words, they would kind of call and update, like, okay, this is how we're feeling right now. This is how the team is feeling right now.
Mm-hmm.
So I don't know if that's always the case, but in this particular hospital, it seemed like the social workers were the ones that actually contacted the family and gave the family feedback about what the whole team was thinking.
Okay. Okay.
Yeah.
I think that's it. So
Okay.
thanks for letting us interview you.
No problem. I'm going to eat my bagel, finish my coffee.
Okay. All right. I'll talk.
Okay. So yeah, it was hard to like hear about like all the processes that are involved, but like a social worker is very crucial to that process, and like you heard in this interview, it just helps the family because in that time it's hard to understand what to do next, where to go from there, and so like it's very crucial for these social workers to have a good relationship with the family and like guide them through the process. Uh, their code of ethics is very important to them, and it's kind of what drives their career. And it states that the primary vision of the social work profession is to enhance human well-being and to meet the basic human needs of all people, with particular attention to the needs of and empowerment of the people who are vulnerable, oppressed, and living in poverty. Which you can see when I was talking about the family and child social workers, that they really focus on making sure that the person is very cared for, and in the healthcare setting, the healthcare social worker is very similar to this, just in their impairments, why they were brought to the hospital. Some of their core values of social work is for service, social justice, dignity and worth of a person, importance of the human relationships, integrity, and competence. So, similar to what we have as the APTA, they have the NASW, or the National Association of Social Workers. It's the largest membership in their career. It holds about, or contains about 120,000 members. And their aim is to enhance the professional growth and development of its members, similar to the APTA, and then also to create and maintain professional standards, and also to advance sound social policies. They also have an OEPR, which is the Office of Ethics and Professional Review, contained in this association, and they provide ethics and professional review education and training. They administer the professional review process for people to get into the association. They offer ethic consultations, and then if somehow the ethic or like something was to go wrong and you're a member, they also provide information to the members who have been sanctioned through the review process. This is a map about showing what states has like how many members. So Ohio is well up there, has about 2,000 to 5,000 members, and then the green ones have the most, 5,000 to 10,000. This is an article I found about the effects of social work on the patient. It was basically a comprehensive study of 16 different studies, and it looked at 16,000 over 16,000 participants, which included pregnant, pediatric, low-income, and geriatric patients. So they looked at what was the effect of social workers on the service and the economic outcomes of these patients, and what they found. So overall, they looked at these 16 studies, and the overall quality of these studies were fair, so that's pretty good. And they found that there were positive effects on health and service utilization for these patients, and that it was also shown that social workers help to limit costs across all reviewed studies, which is amazing. And it's kind of what we heard in the interview with Kevin's dad, that because a social worker went out of their way and realized, hey, the husband was part of the military, let's talk to the VA, see if there's any more funding or anything else, any other services that could be provided through the government, and no cost to the patient. So like in that aspect, they can definitely limit costs for patients.
So now, after we heard a lot about social workers, we're going to get into the case manager aspect of it, and there's going to be a lot of overlap between the two professions, but just bear with us in it. All right, so what is a case manager? It is a generic term for an individual whose primary role and function is to facilitate the process of case management. It is also a collaborative process that assesses, plans, implements, coordinates, monitors, and evaluates options and services required to meet the client's health and human services needs. The roles of a case manager can include, but they're not limited to, academia, health, education, research, insurance, welfare, and social and human service settings. So we thought it would be a good idea to put in the philosophy and guiding principles of case managers, and it is centered around clients and support systems. It is holistic in its handling of client situations as well as that of their supportive systems. The case management process is adaptive to case managers' practice settings and the settings where clients receive health and human services. And this is the philosophy and guiding principles. This is just a little snippet of all of them. We thought it'd be exhausting to hear us say all of these, and I think there's about 50, so you're welcome. All right, so now the process, what we like to call the process of what case managers do. They screen, they assess, they stratify risk, they plan, they implement, they follow up, transition, communication, and evaluation. As you see in the bottom, it says that this list is not linear, meaning that this is a good idea to go check each one down and do your due diligence on each one, but there's nothing wrong to say, we're gonna come back to check out the follow-up, we're gonna check out, do we need to re-stratify the risk, do we need to do X, Y, or Z, just in case. They don't have to follow it like 1 through 10, or forget how many are up there. But I'm gonna go into a little bit on what each part of this process is. So screening, the objective of it is to determine if the patient can benefit from the services. Also, information is reviewed to decide the appropriateness for the case manager. Some things that may be reviewed include claims information, utilization of healthcare services, current health status, and health history. They're usually screened due to diagnosis, high dollar, and high utilization, which high utilization means frequent visits to some sort of healthcare provider. And then stratifying risk determines appropriate level of intervention. I can't even read. Could be low or high risk. Sometimes this is done prior to assessment by an automated system. Health risk assessment and biomed screening are done based on risk factors. Also with the stratifying risk, there are a lot of different case management programs that are also used during case management or with case managers. So planning, the CCMC defines planning as the process of determining specific objectives, goals, and actions designed to meet the client's needs as identified through the assessment process. This should be action-oriented and time-specific. Short and long-term goals are developed here, and the objective of this phase is to develop the case manager's plan of care, and it's usually developed prospectively by an interdisciplinary health care team. So implementation, the CCMC defines as the process of executing specific case management activities and or interventions that will lead to accomplishing the goals set forth in the case management plan. Coordination of care occurs here by organizing, securing, integrating, and modifying the resources needed for the client to reach the desired outcome. And the case manager really in this part acts as a liaison between the client and the provider. So follow-up, the case manager will gather up all the information for the patient, caregiver, and other sources. It is evaluated and determine effectiveness of current plan, and modifications are made if they are needed. So transitioning, this is from different healthcare settings, so maybe in an acute care hospital into a SNF or something along those lines. They educate the family and patient as the patient transitions from one of the situations to another. The case manager will relay this information so care is fluid and there's no breaks within the continuity of the care. So communication, this should be always going on. Asking the patient and the family how things are, the medication management, self-care ability, compliance with the appointments, satisfaction with home health if they have it, or outpatient therapies, and any problems are addressed and resolved in this area, as well as evaluation, where assessment of effectiveness of the case manager's plan of patient's condition is done, focuses on financial evaluation, clinical outcomes, quality of life, client satisfaction, self-care management ability, and knowledge of health conditions in the plan of care. So now we're going to go into some of the education of the case manager. And really it just depends on what cases you would like to work with. They can be as low as an associate's degree. It's preferred that a bachelor's degree in a related health field, such as possibly social work, psychology, sociology, something like that. And then licensure depends on cases worked with as well, and also as the state in which you are practicing in. There are a couple different certifications that we're going to talk about, and it's the board certified case manager, accredited case manager, certified social work case manager, nursing case management board. So the board certified case manager. Did you go back? All right. The CCM credential means that case managers are committed to uphold the highest professional and ethical standards, to maintain certification, to maintain it. The certified case manager must comply with the code of professional conduct for case managers. Accredited case manager, it was created in 2005 by the ACMA, specifically for health delivery system and transition of care. For case manager professionals, it is unique because it specifically addresses case management and health delivery system settings, tests core management knowledge that is shared by nurse and social work case managers, as well as competency in the individual skills of each professional background. It utilizes clinical simulation testing methodology to test competency beyond knowledge. So who takes this? Two different bachelor degrees or professions can take it, which is a registered nurse and also a social worker. And all the applicants must have at least 1 year or 2,080 hours of supervised paid work experience employed as a case manager. And also 90% of the ACM credentialed professionals would recommend the certification to other case managers. And then we have the CSWCM, which is the Certified Social Work Case Manager. And these are for those social workers that have a master's degree and they seek this certificate. They also need to have documentation of at least 2 years, equivalent of 3,000 hours of paid supervised post-master's of social work case management experience, current state master's social work level license or an ASW, MSW level exam passing score, and they also have to adhere to the NASW code of ethics. And then the nursing case management board. It's valid and reliable assessment of the entry-level clinical knowledge and skills of registered nurses in the nursing case management specialty after initial registered nurse licensure. It is an RNBC and it's valid for 5 years.